Bed exercises. Open and close the fingers, stretching out the fingers by making a complete fist. Bend and straighten the elbows, touching the shoulders, then all the way down to the bed. Reaching up into the air, working through the shoulder joint, asking the resident to reach back as far as they can, touch the bed head, working through the shoulders and elevating them as far as they can. Asking the resident to turn to the left, then to the right through their head and up to the ceiling and down towards their toes. Now for some lower limb exercises. Bending and straightening the knee. Bend up as far as they can and straighten the knee as far as they can. Give additional support if the resident needs it, but ask them to do as much as they can. Pumping the ankles up and down to point the toes towards the head and down towards the tail end of the bed. Ask the resident to squeeze their knees and thighs down into the bed as far as they can to activate their muscles at the front of the thighs. Hold them for 5 seconds. Again, ask the resident to squeeze their buttocks together. Hold this for 5 seconds. Back into the buttock and waist muscle. Ask the resident to bend their knees with feet firmly on the bed and lift their bottom up off the bed. This is called bridging. Ask the resident to hold for 5 seconds if they are able. Working through the hip joint, bending the knees up into the chest as far as they can. Again, assistance may be required to guide the movement to the correct range of motion. Encourage the resident at all times, keeping their knees bent, lowering their knees from side to side. This is good for those residents with back pain or stiff joints through the back. Positioning of the hemiplegic shoulder. As shown here, the wheelchair provides support for the left hemiplegic shoulder and arm. Ensure that the shoulder is in the upright position at all times by providing support at the elbow. A cushion is adequate for this. Extend the fingers out as far as possible and make sure the wrist is nice and straight to prevent any contractions. It's important when transferring these patients that none of this pressure is placed on the shoulder and that the shoulder is maintained in a stable position at all times. Now we'll look at passive exercises. Open and close the resident's fingers, extending the fingers out as far as possible and bending them down into a fist. Give the hands and the fingers a light, prolonged stretch. Bending through the wrist, nice and gently, taking it through the possible ranges of motion. In this circumstance, the resident is not able to do this, so the carer must provide support. Bending through the elbow, straightening all the way out to the shoulders, followed by a prolonged stretch. This prevents any contractions and stiffness in the joints. The forearm must be moved up and down, elevating the shoulder as far as possible. This should not be painful for the resident. Stretching through the lower leg, providing support up the leg and bending the toes up. Movement through the ankle for bending up and down provides support at the base of the ankle and at the toes. The movement through the knee and the hip, bending up and down as far as possible. Again, support must be given through the limb.